We're explaining Dr. Sarno, and today we'll focus on the diagnosis of TMS. This is a topic that's very confusing for patients. They ask, do I have TMS? Do I have something else? And this confusion and doubt can actually slow down the ability to heal from pain. So today we'll explain what TMS is. We'll go through 4 other diagnoses that one needs to rule out in order to be able to diagnose TMS, and we'll see how to be properly diagnosed so that you can direct yourself on the path to true healing. I'll also blend in my experience in treating more than 1,000 patients with TMS and my own experience as a former pain patient. So first of all, what TMS is. TMS stands for tension myoneural syndrome. Dr. Sarno coined this term, and he described a condition in which pain is created by a benign and reversible brain-based mechanism. It can affect mostly the big muscles of the body, like in the neck, in the back, sciatica, and other syndromes like fibromyalgia and other mind-body phenomena like that. So the first thing you want to do is make sure the diagnosis is correct. And nowadays we know from official data that 85% of back pain and 67% of neck pain, chronic back and neck pain, do not have a medical explanation. So it means that in most of these cases we are talking actually about TMS. And it's important to understand that because the vast majority of people with chronic pain will not have a medical diagnosis. And then we should consider the diagnosis of TMS. And by the way, this is also called nowadays neuroplastic or nociplastic pain. These are the scientific modern terms. But before we go into the diagnosis, one needs to understand the background and a few very important points. Pain is not a diagnosis, it's not a disease, it's a symptom. And as such, as a symptom, it can indicate that something wrong is going on in the body. And before we say that the pain is caused by TMS or a mind-body mechanism, brain-based mechanism, we have to rule out other medical conditions that could also create pain. So in order for us to describe the other diagnoses that can cause pain, or the major, most common diagnosis that can cause pain, we can use the acronym FIT, F-I-I-T. And F stands for fracture, or more generally speaking, trauma, which means a physical injury that has happened and causes the pain. And here we do not refer to some past trauma, like at the age of 3, or an accident that happened 10 years ago. Instead, we're talking about a fresh, acute trauma that happened recently. This is the F. And then we have the first I. The first I stands for inflammation. Inflammation is a process in the body that happens when we're injured, for instance, or there's acute damage to tissues. And this requires a bit more elaboration. We'll get to that shortly. The next I stands for infection, which is a rare reason for chronic pain. Infections can happen. We have germs, we have viruses, we have fungi, and they can also, in very rare occasions, affect the muscles, affect the spine, and cause real physical pain. And the last one, the T, stands for tumor. Tumors could be benign, could be malignant, but in any case, they are space-occupying lesions that can press other structures in the body and cause real physical pain. So before we can say that someone has TMS, we have to rule out those 4 big categories, the FIIT. The term inflammation requires a bit more elaboration. Here we're talking about whole body inflammation. So for instance, rheumatoid arthritis or in ankylosing spondylitis, when we test the blood and we see real inflammation markers. This can cause pain, and the pain could be widespread. So these conditions of the inflammation are under the umbrella of the medical profession that's called rheumatology. So what's important to understand is that even when we suspect that there might be TMS or there might be a mind or brain-based origin for the pain, we have to first rule out those more serious conditions. They are the minority, but it's very important to diagnose them properly when they are there in order to get the right medical treatment. So the next question is how to get such a diagnosis, and for that, my best recommendation for you would be to get in touch with a professional, with a medical doctor that can help you with this diagnosis. And if you're not sure, I also added a link to a list of doctors that can help you do that, that are aware and are informed about the TMS diagnosis and neuroplastic pain, and are also medical doctors in general, and they can help you make sure that you're doing the right examinations, you're going to the right specialists, so that the serious conditions are ruled out, and then TMS or neuroplastic pain can be safely diagnosed. If you're struggling with pain, and if you're thinking that your pain might be TMS related or come from emotions or tensions, I've also prepared a starter kit for you with a few meaningful resources that you can download for free. It's below this video. And let me know what questions you have, what things you were confused about, and I'm very happy to clarify and explain more. And if you're struggling with TMS, if you're suffering from pain, watch this video here that will explain you further what Dr. Sarno explained, what the TMS diagnosis is, and how to progress with it, using it towards healing.